Все одно. Супер. Доброго дня.
Good afternoon, dear guests. Thank you for being with us today during this briefing. This is about the result of public consultations about introduction of professional licensing of doctors. Our guests are Dr. Ulana, Acting Minister of Healthcare of Ukraine, Oleksandr Linchevskyi, Deputy Minister of Health of Ukraine, and also we have representatives, partners who helped us to hold these consultations. Oleksiy, Dorogan, head of the board Better Regulation Delivery Office, and head of Office of Efficient Regulation, Vadena Gachirets. Welcome. We are going to start. I give the floor to Ulana. Good afternoon, everyone. Thank you for coming. Transformation of healthcare system can be compared with triathlon. We were speaking about it during our previous press conferences that include swimming, cycling, and running. The first level was swimming, and we succeeded. And 28 million of people have their personal doctors, and there is a guaranteed package of services provided to patients. And also we have some parts of our triathlon that should start next year. Starting 1st January 2020, changes will be made in financing at the level of hospitals and polyclinics. And the third level is licensing. We've discussed it. And this is the symbol, this is the sign. This is about the quality of provision of medical services, not only better financing, what we have, but also to make these services improve them. So we will speak about licensing. Our speakers will tell you about it. This will happen in 5 years. We'll have transition period of 5 years in order that those doctors be able to get the license. Our students that will graduate medical school, they will get medical licensing after internship. During the previous meeting of the government, we adopted a plan of actions concerning medical education and those changes that are ongoing, those things, 150 scores to enter medical institution, medical university, then also exam consisting of 4 parts, CROC and English language and international examination, I-form. That was held during previous months. Also, for the first time in Ukraine, based on this examination, they will have done internship, and then they will get their doctor's license. And so we created a concept, and we involved many partners. This was the medical community, patients community, anti-corruption community, as well as people from the Ministry of Healthcare. And we wrote a concept. From the start, when we changed the system of finance, we held consultations with our stakeholders. These were traveling around the country, and in the regions, doctors were gathered, and we spoke with more than 1,000 doctors. They looked through our concept, they commented on it, and later, when the law is approved, their recommendations and those things that they identified as positive and negative, this will be all included in this document. So in order to be a doctor, you need to have a registration, a certificate, a license to provide quality of doctors, in order that patients and National Healthcare Service or employers, they should understand that these doctors are well trained, and also independence of doctors is important. Now they depend on the heads of their departments in the hospitals where they work, and if they have a license, then they will be able to have an access to their profession, and they will be able to choose their place of employment, and they will be able to sign a contract with their employer based on the number of patients, experience, and the work they do. I think that when we traveled and spoke with doctors, there was great support of the concept of licensing. And we spoke a lot about details with these doctors in order to improve the system. Our partners, British Embassy, that sponsors through NDI, the National Democratic Institute, such discussions of the policy. Because once again, in European countries, there is good experience how to involve stakeholders to discussions of the policy before it is approved. And at the Ministry of Healthcare, we did it from very starting 2016, when we spoke about financing in healthcare, and also the loan financing, about psychiatric help and emergency medical help, and all those policies that were developed and were presented to the government, that were approved by the Cabinet of Ministers. They were discussed by stakeholders, and this practice helps in different regions. We have different needs, and here in Kiev, it is difficult to identify those needs in such a way. We are able to get feedback, and we thank Virdio, who helped us from the start with the concept of licensing. Together with us, they developed a concept, and also they were together with us when we traveled through the regions and when we held discussions with doctors, and they will tell you about the consultations that were held. Thank you, Ulana. Now the floor is given to Deputy Minister of Healthcare of Ukraine, Oleksandr Linchevskyi. Before, the issues of professional licensing were not raised. Medical community was working like in collective farm. They, like collective farmers, they worked in hospitals. There was collective work and collective responsibility. There was no personal responsibility for the consequences of treatment. Abstract hospitals were responsible for the consequences of treatment. There was not such an issue of personal responsibility. So all collective farm was responsible for harvest, but no one was responsible personally. Now we introduce personal responsibility. Each doctor now is responsible for his own or her own actions. And this is an unprecedented thing. Simply speaking, the doctor should work in a hospital, in a polyclinic, or as a private entrepreneur. They should do the work as doctors, and they should undergo continuous professional development, and the doctors are personally responsible for their professional improvement. And the third component is the absence or availability of complaints or criminal proceedings. So these are three components. They form the license. So the doctor gets this license based on these indicators. He is working in the hospital. He continuously develops and there are no complaints about him, so he may continue his work. In case of violations, if he does not work properly, or if he, for example, does not improve himself professionally, so he will be deprived of the license. Partly we started to implement this idea, and people discuss this issue in professional circles, and we have partly implemented this idea, and today a doctor is personally responsible for his post-diploma education, and he is obliged to have continuous professional training yearly, not one in 5 years as we have had it before, but he chooses where he is going to be trained and the form of training, and additional speciality may be added. The content of the seminars, the doctor will choose these topics himself or herself. So we will continue in this direction. And before giving the floor to our next speaker, I would like to show a video about these consultations, and then we will discuss what information we got through these discussions.
Публічні консультації важливі, бо
Public consultations are important because when the new policy is introduced, all stakeholders should be involved in the discussion of the policy in order to voice the problems and to understand how it will be implemented locally. For many years in Ukraine, as in many countries, introduction of new policies happened without participation of the public. Now it is changed. The public consultations, this is the democratic instrument of communication to establish friendly relationship among the participants of the process. Together with the Ministry of Healthcare and supported by NDI and other organizations, we were able to hold these consultations on the licensing of doctors. I believe that such consultations they bring information to us and provide us with opportunity to express our own opinion and to discuss this issue. We may also submit our proposals. Without a dialogue, and this dialogue is carried out by such consultations. Otherwise, this decision won't be legitimate, and the community should be involved in the processes. So we have positive view on traveling around the regions. People think about the ministry, about the transformation of this institution, and we are really inspired by this experience. Dear colleagues, these ideas, they are not from the moon. We really developed these ideas. We've discussed these ideas in hospitals during 5-minute meetings. And now, due to your proposals, during these public consultations with the ministry, we are able to document your proposals, and we will be able to implement them to life. Thank you. Thank you, dear colleagues. Now the floor is given to Oleksiy Dorogan, and he is the head of the board, Better Regulation Delivery Office. So about the content of licensing and the information you got through consultations. So before presenting the results, I would like to make a step back and to briefly discuss bad laws. Often they say that in Ukraine we have bad laws. So maybe people say that we cannot do anything about it, but bad laws, this is the category that people do not understand properly. In case of licensing, the law establishes some rules. The Ministry of Healthcare provides these licenses and due to some rules. And before we didn't have public discussions, we didn't discuss in professional community the need for these discussions and to get information whether these licenses are good or bad. So our office studies whether it is efficient. Rules should be clear. They should reach desired result, and when everything is done efficiently, when the expenditures do not exceed the positive effect from these rules. I would like to say several words about consultations, why this work is done, in order to elaborate the new rules, the new policy that would better resolve those problems that we have in our society. In this case, professional licensing of the doctors is needed in order to get better treatment, better service for patients, in order to make our doctors more professional. So we should have a proper plan of actions, and we should identify the role of these consultations in the process. First, we should analyze current situation. We should understand why we need this license, whether it can work efficiently. Here we have statistics on the slide. So the problem looks like this now. 1 minute, please. I would like to cite from what I have here. In Ukraine, the problem exists. There are several indicators in order to have a better impression about the scope of the problem we work with. People die in Ukraine early. People live for about 71 years, and many deaths are connected with illnesses at this age, and quality of healthcare is worse than in Europe. And while delivering babies, 99% qualified care is provided, but we have 23 deaths per 1,000 during delivery. So lack of quality assistance. The reasons are technical first, then technical economic reasons, lack of access to medicines and proper services. And the third category we are working with now, this is connected with licensing of doctors. These are professional reasons. What can we do about this problem? We should identify the reasons why the system that exists now, why it is not enough, why it doesn't provide high quality of healthcare. 3 reasons. The existing system does not influence enough on the level of motivation, of personnel, and also there is impunity in the system, and there is collective responsibility when hospital is responsible, not separate, not individual doctors. So the concept is prepared, then public consultations are held, and we are at the end of the stage. The concept is ready. It will be provided to the government, and the consultations are complete. So this campaign was of large scale. We traveled a lot. It is unprecedented in Ukraine. I have never seen such consultations at such a large scale. We held some campaigns, but we didn't have campaigns at such a big scale before. Campaigns connected with reform of healthcare, they are bigger than in other areas because these problems they are important for many people. We should have clear rules, and community should understand how to influence on them to improve those rules. And we should work on them together. After this, there will be preparation of the draft law that will embody this vision of the concept that was provided by public consultations, and this will allow us to introduce new licensing of the doctors. Thank you. Thank you, Oleksiy. And the next speaker, about what we heard from the doctors. Good afternoon once again. I would like to tell you briefly about our public consultations. So we spoke with doctors, family doctors, secondary and tertiary level doctors, and the organizers in the system, managers and representatives of educational institutions and representatives of postgraduate education institutions, and doctors were really interested in participating. 60, 70, or even 100 people we had for one meeting. So we provided the opportunity to doctors from other regions to join consultations. In such a way, we covered all the regions of Ukraine, all oblasts, where doctors were able to register and to come to consultations. So why we held these consultations? We developed the concept during 2018, and in 2019 it was coordinated within the central bodies of executive power, and then we traveled to doctors to discuss the ideas for the draft law, because this is really important sphere of regulation, and by order of healthcare or by a resolution of the cabinet, these issues may not be regulated. They should be they should involve discussions, and then they should be introduced to the parliament. We wanted to ask doctors how they see this process, because this will directly influence on their professional activity. The most important issues were about the requirements to licensing board. This body will be created, and it will take decisions about licenses, their suspension, revocation, or renewal. So what should be the requirements and how these people should be appointed or elected? What should be the criteria to deprive or to suspend the license of doctor? And about transition period, how to organize the work during transition period. It was really interesting. Such consultations in real-time mode, not just online consultations, but also having these group discussions. This promoted the dialogue, the discussions. We heard many different opinions, even opposite opinions. So doctors' community discussed what model should be chosen and what criteria are more appropriate for this doctor's profession. I would like to the part we heard about the requirements to the members of licensing board. The most important were the priority were the that the person should have higher medical education and also the years of experience as a doctor. And we have had discussions on this, and the average result is that they should have higher education, and the number of years also is important. And we provided our recommendations concerning the most optimal requirements. So this is education, more than 10 years of professional experience, and other priority requirements, including concerning the impartiality. A doctor who is trusted, not only having some high position. His reputation should be really clear. He should adhere to anti-corruption legislation, no violations. Interesting opinion was provided from Lviv. They said that maybe there should be an analogy, a body like Public Integrity Council to assess integrity of the doctors. Also, whether the foreign experts be able to enter this licensing board. We heard many different opinions, and also we had online questionnaires, and the doctor supported the idea that licensing board may include foreign experts if they have experience of work in licensing body of their country. So this may be a practice, and for the first composition of a licensing board and to provide good practices, we may include foreign experts who meet the identified criteria. Further on, we may involve foreign experts also as advisors. About formation of the licensing board, who may be nominated, and the doctors say that they would like to actively participate in formation of this body. The majority of doctors answered that professional associations may nominate people. Also, self-nomination is allowed, and also groups of doctors may also nominate some representatives to this board. About the procedure of formation, I will be brief. The majority of doctors supported the position that the formation of licensing board should be made by direct voting. Licensed doctor should be able to vote for them, and it can be done through information system, online system, where each doctor will be able to get registered and be able to vote for the board member. Also, there may be different representation of doctors of different medical directions. So there should be different professionals from the first level, from tertiary level, from the second level, so from different levels of healthcare. How can we provide it if we have direct voting? The office provided such an answer. This is about the quota of the ministry to appoint some members of the board. So this quota has two aims. First, the responsibility of the state to provide quality help, and the ministry that forms the policy should be involved in formation of the body that should guarantee quality. And second point is to have good representation. So, for example, if they elected, for example, stomatologists, then the ministry may level this representation, and we will have parity of the positions between the community and the state body. About rotation, also important thing that was discussed during public consultations, to provide sustainable activity of the body and at the same time to change people on this board in order not to have the same people through the years, but to partly renew the membership of the commission. So 1/3 of the licensing board will be changed every 3 years. So they will be elected for a 3-year term, and then we will partly renew this board, and this will allow to doctors not to spend too much time for their participation on this board because they have their own practice, and also to provide sustainable institutional work of this body. Next, this is the criteria of suspension or revocation of license. So the license is given for 3 years, and it can be renewed automatically if a doctor adheres to the requirements concerning professional continuous education, and if he adheres to all the requirements. If there are no complaints, grounded complaints of the patients, if he didn't commit any violations, and so professional investigation and professional assessment of the adherence to the standards. This will show whether the doctor be able to continue his license. Also important is absence of criminal proceedings. About suspension of licenses. So licensing board or the court may deprive the doctor of the license if he committed serious violations, some crimes, or some harm to the patient was done. Also, about professional standards, about the role of professional associations. Today they are not really active, but we would like them to get involved to develop professional standards and to be able to assess professional, to carry out professionalism of the doctor. If we are speaking about vaccination, for example, and there's some actions of doctor, they may harm the patient and put the life and health of the patient at risk. So these issues may also be considered by the board, whether to stop the license, suspend it, or revoke it. About transitional period, important issue for the doctors. The majority of doctors who participated in public consultation said that 5 years for transitional period is enough, and the most important is that each doctor, independent of his specialty or number of years or other status, if he wants to practice, he should pass examination, licensing examination. And doctors said that information, materials for this exam They want to have it in free access to understand what will be this examination, to be able to prepare for this examination. So draft law will include all these recommendations and other important issues we've heard during the public discussions with doctors. Now we will have Q&A session. Please ask about the topic of this press conference. Everything else will be off records. Anna Levchenko, Interfax Ukraine, tell us please when this draft law appears and about whether these results of consultations were discussed with the new team, because Mr. Radusky said that, and he says that we should introduce individual licensing. So you spoke about the same thing, I believe. Thank you very much for your question. As I've said, we provide this concept to the new government, and the results of this consultations and draft of the concept and the main provisions of the draft law will be presented to the new government, and the work will continue in the future, and we will have a feedback, and we will have a common vision, and after this a final stage of preparation of draft law will start, and this will happen autumn. And we expect that until end of year, this draft law will be submitted to the Verkhovna Rada for consideration. It is early to say about the time, but it may become this draft law. Irina Shevchenko, Fifth Channel, about this transition period, 5 years. This is from the introduction of law or the order of the ministry. And was someone completely against of the system? About your first question, transition period, it will start from the moment when this law will enter into force. Now we are only preparing for this transitional period, and the ministry is preparing normative basis, but transitional period will start in accordance with law. About the second question, during public consultations, we didn't hear any objections, and doctors were consolidated. They understand the necessity to introduce such changes, and the discussion was about details, about some procedural issues that the law should embody, but not about the concept itself, not about the idea of licensing. Thank you. Next question. Oleg Lemishuk, Kiev TV channel. You've said that previously licensing was done one time in 5 years. Now it will happen yearly. So the workload will increase. Well, what will happen to those doctors who won't pass licensing, and whether the salary be increased if they pass these licensing regularly? Previously, once in 5 years, a doctor wrote self-assessment report. There was no sense in it. This is paperwork. It was not needed. So no one knew why they needed, and it was signed by chief doctor, chief specialist of the town, region, and oblast, and it was brought somewhere to attestation commission. Once in 5 years, a doctor was obliged to have re-attestation cycle, 1 or 1.5 or 2 months. So this was a pre-attestation cycle, and he passed an exam with questions that are not correct medically, and they just learned it by heart as a verse, using mnemonics they just learned these questions by heart. It was just a test that was just formal. And then they came to attestation commission, and people on attestation board were not specialists in your field. They asked formal questions, and they had only formal assessment, whether you can get a category, whether you confirm some category. So there were a lot of formalities and no sense at all. So about corruption in the system, yes, there were corruption cases, and doctors are against this terrible bureaucracy, and doctors got united against this system, and they didn't want to write these long reports. They tried to avoid the procedures of pre-attestation cycle. And it was the same once and once again without new content. How to simplify the procedure of attestation because it was bureaucratic. And the system was so senseless and so cruel that medical community got united against the system, but it was informal. Unification, and now the system of professional development, people want to know where they can go to study. They want to find something new and interesting. They want to go somewhere. They discuss it, and due to the new order, doctors get united. We do not have this self-assessment. We do not have pre-attestation cycle, no attestation. We provided doctors with opportunity, yes, yearly, but to pass real courses that have good content, and people want to attend such courses. Previously, they were obliged to go some institutions, to some academies, and to study there. And now we allow people to go where they want to go. And I assure you that those doctors of yours, they want to do this. Those people who went through the system, these doctors, they have good in their hearts, and these doctors now may be real doctors, because doctors, they are representatives of the profession. They should study all their life, and now they can study where they want to each year, and this is good for patients and for doctors, and this should be like this. And about the licensing, it will happen once in 3 years, but each time they should have, each year they should have 50 scores to have this continuous education, 50 scores, 50 points where they want to have it, and the money in the budget. The money will be provided to each doctor, and the doctors will be able to choose where they want to go to study. And each 3 years, a license will be automatically renewed if they have this 50 points yearly. And this we will have a portal, and our we will have a special council, and there will be a study of the doctor. They, if they attend some courses, they will provide this information to the system. And if each year they have 50 points and there are no complaints to licensing board against this doctor, or these complaints were not confirmed and there were no criminal cases, automatically the license will be renewed. They should not go to attestation commissions, they shouldn't submit any documents, and the doctors are really concerned about all this, and we are happy that we started those steps to have this continuous professional development. Now doctors may study the second step, and this is the important part of licensing process. The next stage is to create an organization that will provide the number of scores and that will identify what courses should be attended, and also law on licensing, the third stage. And from the start, we started to speak about licensing of doctors when we entered the ministry. And now we are at the stage when the concept was written, and there were public discussions and the cycle of communication with doctors, with associations and patient organizations and others. This is a long process. This is a big change. This is a big change, not only for doctors, but also for all professions in the country, because now advocates and lawyers, they speak about their licensing, because the concept of licensing of professional activity, not economic, but professional activity. This concept, it is not in Ukrainian legislation now, and we introduce it to the legislation through this professional licensing of doctors now. Irina Rozova, InterTV channel. We know that there is a ground for quality health, medicines, modern equipment, and precise testing. What is the sense of licensing if a doctor do not have opportunity to provide quality help if medicines or equipment is lacking? So licensing, introduction of licensing is the introduction of the new culture of relationship between the doctor and the patient, between the doctor and the state, and inside doctor's community. This is the right and healthy rules of work, of coexistence in a healthy medical environment. If we are speaking about the results of treatment, when we introduce such model of licensing, each patient, due to introduction of such model, he will have a feedback due to professional responsibility of the doctor for decisions that were taken by him. Not collective, as I've said in the beginning. We are speaking about the emergence. For the first time, we have it. We didn't have it in the Soviet Union, and there is a precedent of emergence of personal responsibility of the doctor for his professional development, for his career, and for the results of treatment of the patients. So this is a really important law that will form new society and new phase of the new healthcare system. Do you have other questions? If there are no questions, we thank you all for your attention. And we have press release. You may have it, and the full report concerning the results of public consultations will be put on the site of the Ministry of Healthcare. It will be in free access. Thank you.